So there are 3 trials that are currently ongoing to look at the use of immunotherapy in first-line treatment of metastatic or recurrent head and neck cancer. These are patients who have not previously progressed on platinum-based therapy. 2 of the trials look at a combination of a CTLA-4 drug with a PD-1 drug and compare that whole approach to standard chemotherapy with cetuximab. And then there's another trial where the question is actually asked, how do you combine chemotherapy and immunotherapy? And so this is a trial of pembrolizumab monotherapy versus pembrolizumab with chemotherapy versus the combination of chemotherapy with cetuximab, which serves as the FDA standard. And the reason I'm very excited about that trial is that one of the things that's plagued us a little bit with the immunotherapies in head and neck cancer is that the response rates are a little bit modest. And so in the pembrolizumab data that led to FDA approval, the response rate was about 18%. And so for patients who are symptomatic, for patients who have bulky disease in the neck, for patients who may be at risk with the airway or at risk for bleeding, an 18% response rate isn't really that high. And so the question of whether or not you can add chemotherapy that will lead to a rapid response and integrate it with immunotherapy, which may lead to a much more durable response, I think is pretty intriguing. The trial is accruing well, and that's an answer that we should have within a year or so.